Hi, my name is Angela Cunha. I'm be filming my Foley catheterization exam today. Hi, my name is Angela. I'll be your nurse today. Can you tell me what your name and date of birth is?
Pat Smith, 1195.
Awesome. So that's what I have. It says on your armband. So I did take a look at your chart, and the provider has ordered a Foley catheter on you today. Do you know what that is?
No.
No. So it's a small tube that goes up your urethra into your bladder, and it helps drain the urine out of your body. Do you have any questions about that?
No.
No. Okay. So before we begin, I need to ask you, are you allergic to iodine, shellfish, or latex?
No.
No. Okay. So I'm going to go ahead and I'm going to position you that I need you in to be in for this procedure, okay?
Okay.
All right. Go ahead and this. And at this point, I will perform peri-care, okay? All right. So I'm going to be setting up my sterile field now. I'm going to be quiet and my back's going to be towards you, okay? But if you have any questions, just let me know.
Okay.
Okay. All right, so it looks like I have my Foley kit. It's a 14 French. It's latex free, and it's expired in 8/31 of 2021. But for testing purposes, that's okay. It takes 10 milliliters of sterile water, and it looks like the package is intact. There's no rips or moistures, and it's okay to use this package. All right. I'm going to put a little bag here next to your hip, okay?
Okay.
Okay. So I'm going to go ahead and open it, making sure that the first fold is away from me. Okay, and shiny side is towards me. Making sure my 1-inch boner. Okay. I'm going to imitate that I'm going under the patient's legs and pulling this up. Okay. So I'm not going to be using the sterile gloves here that's provided in the kit. I do have my own. So it looks like it's a size 8 sterile gloves. It's expired on 7/2017, but for testing, that's okay. Looks like the package is intact and there's no moisture. That's okay to use. And I'm gonna go ahead and put this on right now. So let me see here. Oh, but before I do that, I do need to put this in position. I'm sorry. Let me go ahead and do that. Let me just put this in position. All right, so I'll go back to my gloves here. And before I do this, I will be taking off my gloves. My watch. And I do know that you have to wear gloves. All right, so I have my sterile gloves on. Okay, and then we're gonna go ahead and begin the cleaning. Okay, so let me go ahead and do that. I'm gonna use this paper as trash now. All right, and I'm gonna go ahead and begin the cleaning. Okay.
Okay.
So I will go ahead and I will clean the patient's labia from outer to inner with the cotton balls. Okay, ma'am, if you could take a deep breath for me, okay?
Okay.
So at this time, I'll go ahead and insert the catheter until I see urine, and then insert 2 more inches and pull back until I meet resistance. Okay, so the catheter is in, but it's not secured yet, okay? So try to stay still for me, all right?
Okay.
So at this time, I will go ahead and remove my gloves. So this time I'm going to go ahead and tape the catheter, but I don't have any tape or anything like that, so we're just going to pretend. And then I was going to go ahead and set this up. I don't have a hook, so I'll be hooking this on the side here as best as I can. Okay. How was that procedure for you today?
It was fine.
Okay, great. So then I would document that they placed inserted a 14 French Foley catheter. I put 10 milliliters of sterile water into the balloon. I would document the color, clarity, and odor if I emptied it out the bag, and notate the amount of urine that came out of the catheter. I would also document when I inserted it and how the patient tolerated the procedure. And then I will wash my hands. Put this garbage away. I will wash my hands on the way up. So now it's 3 days later, okay? Hello, my name is Angela again. I took care of you a few days ago when we put in your Foley catheter. Could you please state your name and date of birth for me, please?
Pat Smith, 1195.
Awesome. So that's what I have on your armband. So I looked at your chart, and it looks like the provider has ordered for the Foley catheter to come out today. So it'll be a pretty quick procedure, and it shouldn't be too painful. And we'll get that out for you, okay?
Okay.
Okay. So first I'm going to go ahead and empty out the bag. And I don't have a granulated cylinder, but I will use a little tube. Okay. Put my chucks down here. Is unclip the alligator clip and the meta clip, and I'll let the urine flow. Let the urine flow out. Put the clip back in, and then secure the alligator clip. I'm going to push this out of the way so that it's not in the way. Okay. Go ahead and go ahead and untape this here, and then I will go ahead and okay, so I'm going to go ahead and remove it for you, okay?
Okay.
Now, normally this would passively deflate, but for testing purposes, I'm going to actively deflate the balloon, and I'm going to pull up until I see bubbles in the bifurcation. Okay, and go ahead and I remove the catheter here. How was that for you? Was that okay?
It was fine.
Okay, great. So we want to make sure that we monitor your next 3 voids, just to make sure that everything is, that you don't have any indication of a UTI. So just let us know before you urinate, okay? And then you understand everything?
Yes.
Okay. So I would document that the patient tolerated the procedure well, that I took out the catheter, and I took out 10 milliliters of water, sterile water from the balloon. I would document the amount, color, and clarity, and the odor of the urine that I emptied out from the bag, and then and the patient tolerated it. And then I will wash my hands on the way out.